You are watching One Health Television. Every individual has an infinite capacity for healing. The infinity symbol stands for the infinite potential inherent in each individual to live the best version of themselves. The treatment philosophy of NutriWell is based on the simple assumption that all healing comes from the amazing regenerative capacity of the body. All it needs to heal is the removal of the offending agent and nourishment with balanced nutrition in the form of vitamins, minerals, proteins, carbohydrates, fats to assist in the repair process, hence creating conditions for the body to repair and heal itself. Natural plant-based herbs and spices like turmeric, ginger, aloe vera, tulsi, holy basil, amla, Indian gooseberry, etc. have been known since the Vedic times to support health and healing. Integrating this ancient science with modern nutrition and behavioral modification protocols improve health outcomes significantly.
A very good evening to one and all. Welcome to this webinar by Dr. Shika's Nutri Health. And in today's session, we are going to be talking about oral health and pain management. And for this, with us, we have today Professor Dr. Silverio D. Roca and Dr. Shika. Let me introduce you all to Dr. Silverio. Dr. Silverio practices in general dentistry and prosthetic rehabilitation. So he's been working in this sector since 1974 in Argentina. And from 1976 to 1982, he has worked as the director of the department for the Argentinian Army. From 1982 to 1990, he has worked as a dental practitioner in Italy. And from 1999 to 2004, he has worked in different clinics across the United Kingdom. And from 2004 to 2013, he has worked in different clinics across Switzerland. He has acted as a visiting professor and associated professor at various colleges, just to name a few. He was a part-time professor in the master degree in orthodontics. He was a visiting professor in the Sevilla University in Spain, in Maimonides University, Argentina, in orthodontic Chieti University, the School of Osteopathy in London, the Dental College of Dentistry in Sicily, Italy, and in the Siena University, Italy, and other various other colleges. He also has featured as a guest speaker at various platforms. To just name a few, like the Medical College of Tenerife, Spain, Dental College of Barcelona, Dental College of Dentistry at Gran Canaria Island, Spain, and he has featured on the International Congress of IFUNA, the International Functional Association, Barcelona, Spain, the Collegio di Docenti University Milan in Milan, Italy, and Physiotherapy School, Barcelona, Spain, and this goes on. He has also come on different international forums in other than in Europe, also in Dubai, India, etc. And from 2014, he is associated with the R.M.P. University, where he acts as a director right now. So second speaker for the day is Shika Sharma. Shika Sharma is a medical doctor by training from Maulana Azad Medical College, New Delhi. She founded Dr. Shika's Nutri Health with a desire to work in the prevention of lifestyle-related disorders. The organization is a pioneer in integrating modern nutrition with Vedic nutrition and serves clients across the globe. She has built a telenutrition center and a personal health app, Vedic Diet, which helps in delivering personalized advisory and top-line monitoring, and a concept introduced in the area of wellness. Dr. Shika had a weekly column for 11 years in the national newspaper ST Branch. She has also been quoted by several leading newspapers and magazines like Times of India, Fedina, Cosmopolitan, Huffington Post, Economic Times, to name a few. Dr. Shika appears regularly on television channels like NDTV, Easy Business, and others. She is also invited frequently for giving talks by this magazine, Association, or Indian Association, etc. She has also delivered lectures to the students of top engineering and management institutes like IITs and IIMs. Dr. Shikha was written about by India Today in its
I think Dr.
Hello.
our moderator dropped off. So firstly, let me warmly welcome you to
Thank
this
you.
panel. We are very honored to have you on our panel today. And as you know that globally, because of the pandemic, a lot of people today have started thinking about their health, overall health, not only basic health and immunity, but health regarding their nutrition, dental health. Even people have started getting into exercise programs. So today we thought that let's look at the two areas which are your specialty and which are oral health and pain management. Of course, you are a very renowned speaker, but today we thought we'll touch upon two areas which are very important. So with that, we open the session. And would you like to have some opening remarks before we start with the questions?
Okay, thank you. Thank you so much for your invitation, because I think you have a very big audience in India, and I think the message that can arrive to a lot of people. I know there is a lot of people who is not in the medical side. No, it's just people, common people, normal people, people who live the life in every country. And I will try today to explain a special topic that is how sometimes, people, they don't know how the craniofacial system or the oral health can interfere in the chronic pain. And that is the topic of today. And if you like, we can start the presentation. I can share the PowerPoint, and then we can start for the people, okay?
Yeah? Yes, please share the PowerPoint.
Okay, thank you so much. Let me share my screen, and then we will start the presentation for the whole people. All right? Right. Okay. As I told you before, the chronic pain. Let me see if. Okay, I think now the screen is sharing. Yes.
Yes.
Okay. Then we're talking today regarding the oral health, but oral health in the sense, in a different sense, just not the teeth, because oral health is not just the teeth. And I want to explain for the people who is here with us how sometimes when that system is not working well, how can interfere with the rest of the body, and also how can create chronic pain. Okay, this is me, and this is a little short, but that's the presentation. You give the whole presentation for me, okay? When we're talking regarding chronic pain, it's something that I believe, and I think we have to prevent. And if we do prevention in early age, mainly, we do not have chronic pain in the future. And that's why the topic I prepared today for the whole people is how to individuate this special situation of, we call that the craniofacial system. I will explain what is that, and the chronic pain, and how to prevent in early age. And that is important. This is my school. Our school is called Myofunctional Postural School. Myofunctional Postural Rehabilitation. MPR International School is a school that we prepare the whole medical science, medical doctors, dentists, physiotherapists, osteopaths, nutritionists, everybody to treat the patients. And we were talking today regarding the craniofacial dysfunction and pain, how to individuate that, how to treat it, how to prevent it. Who is craniofacial? This craniofacial system, because here there is people who is not a doctor also, mainly of them, they are not doctors. And when we're talking regarding the oral health, we think is only one part of the body. But our mouth, many people know who is the name of TMJs. TMJs is the joint of the jaw, no? But there is people who are dealing with that problems all around the world. But the whole system, we call that the cranio and the face. Craniofacial system dysfunction. This system is connected with the rest of the body. And when we have a dysfunction there, we can create slowly, chronic dysfunction in the whole body. And I will try to explain today for the whole people how is this. The alteration of the muscle. Normally, the people said muscle. What are muscles? If you see our body have a lot of muscle. They move our body. And these muscles are doing the movement through the central nervous system, who is dealing with the movement of that. And when we have a dysfunction, that means a not good function. In this, we call that neuromuscular system, neuromuscular skeletal system. We can have, at the end, a chronic pain and a postural disease. And that is very important to understand that craniofacial system is not just teeth. Because the people all around the world, and also sometimes some specialties, they don't understand that it's not only the teeth or the jaw, it's the whole cranium and the face connected through the neck with the rest of the body. And when this system is not in good function, it can create a very, very big problem, but very slowly. The problem is created chronically, and at the end, we have chronic pain. When I listen the word chronic, I am not happy, because if something is chronic, it's because we are not we don't do the prevention to do not arrive to something chronic. And that's why I want to try to explain today how we can do that. Okay, our body is all connected. All we are individuals, and we are the individuals who all the systems are working in synchrony. I will try to explain very simple the situation. No? We cannot start to talking here about neurology or neurophysiology. It's just common words. We are a human being that we are connected, and we cannot treat any part of the body individually. We have to treat the whole system. And craniofacial system is part of our body, and when this system have a dysfunction, as you know, our jaw, our lower jaw, have a big movement, and when this jaw, for any reason, we are not here to discover the reason, because we need a curse to discover that, therefore do the big diagnosis. But when the jaw, for any reason, is not in a good position, it's not in balance, we said, that can create a dysfunction in the craniofacial system, and then chronically in the rest of the body. How does the craniofacial system affect the posture? Because we are talking about our posture. We're talking about our postural disease. And the postural disease is a common disease all around the world, who suffer a lot of people with the common symptoms. I will talking later about the symptoms. But when the mandibular, the jaw, the lower jaw is changing the position, it will affect the rest of the body. When this relationship is lost, You know, in our body, I will try to explain something very, very simple regarding posturology. Our body have the muscles working well because we have in our body a lot of receptors. The receptors, imagine the whole people, our brain like a computer, like a PC, who is elaborating the information and the actions we have to do every day. And this PC have the receptors, the informers, to say to him, how is the environment we are living? These receptors send the information, the brain elaborates the answer, and we have a good balance in our body and our muscles. One of the main receivers, one of the main receptors of this, we call that system common, is tonic postural system, who is the system who is doing the muscle tone to we live in our world, in our environment. One of the receptors is the oculomotor system, is the eyes with the movement. When they move, it's like a telecamera, who is moving and it's positioning the head and the whole body in balance. When this system is not coordinated, our head changes the position, our muscles are not working well, and then the posture is altered. And when our jaw changes that position, it's affecting one of the main receivers or receptors, who is the oculomotor system. The forward position, retro position, lateral deviation, that will affect, you will see later how, that will affect the rest of the body chronically, not immediately. That's why I said, if we treat our child when they are very young in an interdisciplinary concept, that is one of the things. We're talking about nutrition, we're talking about the food support, we're talking about a lot of things. But one of them is the craniofacial system. When that is not working well, it's affecting one of the main receivers, one of the main receptors. The movement of the eyes are working mainly in the lateral vision. When that movement is not coordinated, or is coordinated bad, is not well coordinated, it will affect the peripheral vision, and we will adapt our head, and then we will adapt our neck and our posture chronically. How the jaw affect? The lateral deviation, when the jaw is changing laterally, it's affecting one of the eyes, and it's creating in the posture an overload, unilateral overload. Look at that. This is the test normally we do for our patient. What I show you is a test to test the motility of the eyes. When we have a bilateral changing of the position, it will affect both eyes. We call that bilateral hyperconvergence. And that is affecting our posture in forward or back. Imagine one changing of the position affecting the eyes, affecting the posture. Imagine that chronically, what can create. This is another patient who bilateral hyperconvergence. I'll show you 2 or 3 cases. Lateral changes affecting one eye. This is an instrument to measure the posture and look at an overload of 5 kilos when the patient closed the mouth. Look at that. Another side, another eye affected, an overload also. And here, the third patient, forward position, both eyes affected, no changes in the lateral side, it's changing the body center forward. Imagine how can we affect it with the losing our jaw position, our posture. How we resume deviation of the jaw, affect the motility, and generate stress chronically in the muscle chain. What is muscle change? Muscle change is the whole muscles of our body. Imagine if we have a chain of muscle who are working coordinated. And when that muscles are stressed, they are creating the postural alteration and chronically the chronic pain. How affect the jaw position, the muscle change? With the bruxism. The bruxisms create muscle hyperactivity and chronic postural alteration. When we change the jaw position, the teeth are blocking this situation. That is creating overload in our joint. This is dangerous, and the brain have the only defense is bruxisms to destroy the teeth. Bruxisms, it is not stress, you will see. The change of the jaw position, increasing the pressure, alarm, bruxisms, and then postural alteration. It's coming from the top, creating slowly problems on the back, arriving chronically to the foot support, and then creating a postural disease. Bruxisms is a TMJ defense. That very bad defense. When the joints are under stress, is dangerous. The defense is bruxism. Bruxisms creating a domino effect into our muscles, chronic pain and injury. Imagine something like a jaw who is not in the right position. And sometimes we don't understand that. And we think our oral health is only just to have a good teeth. Straight teeth, white teeth, that is important, obviously. But most important is to have a jaw centrated in a good position with the rest of the body. Bruxisms is not caused by stress. This is a misconception. The people think that grinding the teeth with the bruxisms, this is a stress. No, this is a defense, but chronically is creating stress, obviously. Bruxisms cause stress. The back position, the back situation is when the jaw is on the back, as you see there, on the back. It's creating hyperactivity in these muscles. It's creating neck problems. It's creating, at the end, adaptive scoliosis. Scoliosis, it is not a disease. It's an adaptation over these dysfunctions. With chronically, this hyperactivity is descending and is arriving to the lower part of the body, and the adaptation is scoliosis. This situation, as you see there, is adaptation. It is not, and it's caused by dysfunctions, a lot of dysfunction. One of them is the craniofacial dysfunction, the foot support alteration, nutrition, hypersensibility of the food, a lot of things can create postural alteration. Look at that. A lot of patients we normally see, they have the same problem. Postural alteration, craniofacial system dysfunction, oculomotor system dysfunction. I can show you a lot of our patients who they suffer and all around the world, there's a lot of people who have this, we call that chronic pain. The chronic pain is because we do not intercept at the beginning the situation. As you see, all the patients have the same picture. And for the diagnosis, obviously, we have to, the doctor had to be trained and in an interdisciplinary concept, just not to see only the teeth, only the nutrition, only the food support, only the physiotherapy in our school. We teach that an interdisciplinary protocol to speak the same language and to treat altogether the patient in the same way. This is the main symptoms that these patients suffer. A lot of people all around the world have headache, dizziness, the loss of the balance, noises in the ear, cervical pain, diffuse muscle pain, tiredness when walking up, difficulty in sleeping, tingling in the hands, lumbar pain, mandibular click, deviation in the mouth opening, a lot of common symptoms who are related with this neuromuscular dysfunction where it is involved the craniofacial system. When we diagnose it, we study, we are not talking here about diagnosis, no, we study how the body is losing the balance, the movement of the neck, the oculomotor convergence, and we study also with an instrument, we call that posturometry. With an instrument, we can measure the balance of the receptors. We can measure with that simple instrument, it's a podometer, we can measure how they are working and what is the disease. Our body, remember our body is founding our brain is founding every single moment of our life is founding our best body center. Our best body center. We need to have a good body center. With this one, we can study. This is a body center with different sensors who study the body weight distribution, how the mouse can affect the feet, etc., etc. We can do a diagnosis. By the treatment of this particular craniofacial dysfunction, we have to annulate. We have to annulate the situation. Very simple is to annulate. We call that deprogramming the jaw, annulating the jaw. If we deprogramming all the situation, all the stress of the muscle change is finished. The objective is also to have an interdisciplinary treatment with all medical sciences. In our protocol, work together doctors, dentists, physiotherapists, osteopaths, nutritionists, etc. With a true interdisciplinary work that you can obtain an harmonious general balance in the whole body and effective treatments. Medical treatment, dental treatment, rehabilitative treatment, nutrition and treatment in a comprehensive and interdisciplinary treatment. But the main objective is, for the craniofacial system, is annulate the jaw position. And I invented many years ago a device which is called body equilibrium device. It's not a simple bite. It's a special device who is working, annulating the craniofacial system and working it's a thermoplastic device that the people use during the night, and it's annulating the stress of the craniofacial system in the body. When we use it, primarily when we sleep, and also when we have exercises, when we do exercises, long trips and stressful work, we can use it. And I will show you how it's working. Look at that. This patient with a craniofacial system problem, and look at here. The 4 kilos overload with the bed is 0. Another patient, 4 kilos, 0. These patients, we can prevent that situation in early age. In early age here, and early more than that, we can prevent. We call that prevention. This little lady, if we start in that age to treat the whole systems, we can do prevention. We call that craniofacial, myofunctional, and postural orthopedics. We develop the growth of the child to do not arrive like this. From this, we prevent to do not arrive like this. The development phase, when we are growing, this is a special device who during the nighttime usage is stimulating the growth and changing the situation in early age. And look at how the craniofacial system is changing. We can prevent in that age. We can do prevention. Look at how the childs are modulated. You can save the life of a patient in that age with a simple treatment of craniofacial orthopedics. You can guide the growth, you can stimulate the growth, and you can arrive at when the patient is adult without problem. Look at patients young, how it's changing the mouth and also the posture. And early we start, obviously, early we can prevent. Look at how the patients change when they are young. When they are very young, they change the face and the body and the mouth. That's why we said the prevention in the oral health is this, not just the teeth. Obviously, look at, they have a good teeth. She has a very good teeth, but it's important the face. It's important not just the teeth, the face, the posture, and look at how she started and how it's finished. This is the goal. With the posturometer, we can measure that. And that is the topic I try to explain in a short webinar. It's a very complicated topic, but I think with this concept, the people can understand that you can prevent this situation in early age to do not arrive as a chronic patient when you are an adult, and it's more difficult to treat the situation. I hope and thank you so much for your participation, and thank you so much for your invitation also. Thank you so much. And if you have any question, I try to concentrate the topic. It's a very long topic to talk in a half an hour, but I hope the people understood the connection between our craniofacial system and the rest of the body, the nutrition, the ergonomic posture is very, the field is enormous, the field, okay? I hope you enjoyed the presentation, the short presentation.
Yes, thank you so much, Doctor. And I must say that it was an amazing presentation where a lot of people would not have known that if their teeth are not aligned properly, it can impact pain in their neck, it can impact their posture, and if it's not treated on time, it can actually impact the entire structure of their face. So this is very important because many people think that teeth is connected to only dental caries or oral health. But like you correctly pointed out, that it is connected to the entire structure of the mandible, which means that the correct mandible plus pain, because the whole thing is connected to the muscles of the face, and also to the posture, which can lead to further pain and imbalance in the posture. Over here, I would like to ask some questions. That dental health actually is connected to many disorders or many other diseases of the body. So could you also share with us that poor dental health, what are the other body disorders it can cause? Like, does it affect the heart? Does it affect any other body organ? Poor dental health?
Yes, our craniofacial system is affecting a lot of part of the body, but a lot of part of the body. We starting for the hygienic, because if we have a very bad hygienic, we can create an infection, local infection, that can create problem chronically in the heart, in the rest of the body. For example, we can create, when we have dysfunction, local dysfunction, also we can create, we don't have a good training in our digestion also, in our alimentation, in our nutrition. And the oral health, I'm talking today only with craniofacial system and chronic pain, but there's a lot of problems we can create if our oral health is not good. And that is why we, in our school, we said prevention. Because if you teach the people, when the people is very, very young, how to eat, how to clean, and the dentist is training to develop the growth of the craniofacial system well. And you have a good, you're a specialist in nutrition, you know better than me that. If in that age you teach the people how to eat, a good nutrition, a good alimentation, all these things is not creating in an adult patient a lot of problems we see with adults, because I treat a lot of patients that more than 40, 50 years old, that we can do the situation better, the life better, but we can prevent in early age. That's why I am very fanatical of prevention. Prevention is the most important thing in our life, and that is very important for the audience and for the professionals to treat all together, because sometimes, you know, in our formation, we are very brave to work. The universities training us to work very well, but we don't have a common language. You know, if I don't know how you working in nutrition, and if you don't know how I am doing in the craniofacial system, and if the medical doctor don't understand how to do the rehabilitation or the physiotherapy, it's very difficult to work together. No, when I invent the protocol, the NPR, it's a protocol of common language and common diagnosis and common therapy. No, and I believe, and I very, very believe that in the prevention is very important, that to have pediatrician, doctors, dentists, nutritionists, physiotherapists, osteopaths, working with the same point of view, just to develop the body of the child, to educate the families and the child. Because, you know, another concept is the family, you know, because, you know, the grandmother say, oh, look at my grandchild, is sitting a lot, oh, look at here, it's very, very powerful. And it's a very bad nutrition, that, you know. But that we have to change. I think and I believe if we change in our medical sciences, in that age, the situation, we will have a good generation, healthy in the future, without chronic pain. And that is my belief, right?
Yes, like you very beautifully highlighted that a holistic approach with nutrition, with pediatrics, everybody coming together to treat the patient rather than the patient being treated in silos or in disconnected method. So, since you have mentioned children, now over the years we have seen that a lot of children across the world are moving from fresh fruit, vegetables, and the act of chewing to a lot of refined food and a lot of sugar. So, have you seen a change in the kind of diseases? Because if, I mean, in 20, 30 years back, the kids were eating more carrots and more fresh salads and more fruits. But today, a lot of that content of food has been changed to sugary food and ready to eat meals. So, have you seen a change in the health status of the children?
We believe that the healthy nutrition is the natural nutrition. But perhaps our society, the big disease is our society. It's not the child. Because today mothers are working, they have no time to prepare the foods, they go to the supermarket, and we eat a lot of ingredients that they are not healthy for the body of our child, of our adults. Imagine, we are talking now in a very, very special situation today, who is COVID. No? The main defense we have for virus is our immune system. And the immune system is relating with nutrition, intestine, vitamins, exercises, etc., etc. Imagine if you have because a virus needs an hostess to live. If the hostess is powerful, the virus is doing nothing. No? But if the hostess is very weak, the virus is creating a lot of chaos. Nutrition is very important in early age to eat natural food. We call that the natural cooking, no pre-cooking, just fruit, carrots, a lot of vitamins and ingredients, but a good balanced diet. In our school, we teach that for professionals to say, please teach pediatrician mainly, not just measure the body or the head, if it's how is the weight. No, teach the people how to eat. Hippocrates said many years ago, the father of the medicine, do that the nutrition is your medicine. Nutrition is your medicine. If you have a good nutrition, you will not need a lot of tablets or supplements we take, because we have a very all around the world, because the new generation in our school, we said our generation of the history of the human being is the generation who eat more than the necessary and bad. And that is creating a lot of hypersensibility of food, a lot of intestine problems, a lot of intoxication. And when we have the body, for that reason I told in the presentation, that it's not just the craniofacial system. It's nutrition, it's exercises, it's physiotherapy, it's a lot of things. But nutrition, if you can develop a child with a good craniofacial development and a good nutrition, you will have in the future a healthy human being. This is the goal. I have to convince the medical sciences to go to that age and not at the child just do treatment. Obviously, in this society, it's very difficult. It's very difficult sometimes because all the people work, the mothers are working, and they go to the supermarket to pre-cooking food. But this is not healthy, in my opinion.
Yes. So my next two questions would be around, first is chewing. Like, how important is good chewing for the whole mandibular system? And if people don't chew and suppose they just take big bites and just swallow the food, what are the problems which can happen to the whole structure, or otherwise? What are the problems?
It's a good question, because mainly chewing is an exercise for the muscles. If you chew, muscles develop well. And if the muscles develop well, the bone, the structure, develop very well. We have to chew in each side, not in one side. And we have to chew a lot. Why? Because the digestion starts in the mouth. If you don't chew, you are making go down the food without the beginning of the digestion. And you will have a lot of problem in the stomach, in the intestine, also because the people are not chewing well. That is important. It's very important. Very important for the growth, local growth, and also for the whole body.
Yes. The second question is that a lot of people, and in many countries, they stay indoors and they don't get the sun, and they are deficient in vitamin D. So, for good, strong teeth, what is the right thing? Is it because a lot of people, even in our country, now have switched to just vitamin D sachets? And what is the role of sunlight? What is the role of uh, calcium? How can people make their teeth strong in a natural way?
Obviously, sun is health for the body. I don't know if you know, there is many years ago, there is some countries in the North Europe, in the very, very North Europe, that they pay to the people, some cities who they don't have sun, to take holidays in the sunny countries, because sun is very, very important. You have to take the sun because it's creating vitamin D. And also we have to, if we don't have vitamin D, we have to supplement, because vitamin D is very important also for the immune system. Very, very important. Vitamin C, A, and D are very important for the immune system. More in this situation, no? And you need vitamin, no? And you need a nutrition who support also. And another thing is we are not habituating to do exercises, no? But not exercises to go to the gym. No, I'm not telling to do a bodybuilder. No, no, no. But walk, just walk. Breathe the clear oxygen, take the sun. That is created mainly in the child, mainly in the child. In that situation that we have to use the mask because we have to prevent. We are not taking oxygen. But we have to walk a lot. We have to take the sunshine a lot and supplement our body with the vitamin necessary for the immune system. It's very, very important. That's very.
Yes. So, like doctor, a lot of women and with age after menopause, they start losing teeth. Some because of deficiency, some because of dental plaques and caries. And with time, a lot of people lose a lot of teeth. So, what are the some thumb rules or some basic tips so that people can have good teeth for a very long time, especially women, because women have hormonal changes, and then they start having even after menopause there is a lot of erosion they start having. So how do women manage a good dental structure till senior years?
Okay, the losing of the teeth is for different reasons. It's not just the menopause. The menopause is one of the reasons which changing our hormones body, and they creating in the gums some problem. But it's not that a very big cause. The teeth, we lose the teeth because we don't have a good hygienic in our teeth. Because we don't chew a lot, because we don't eat a healthy teeth, because we don't clean our teeth very well, and because we have trauma. And one of the trauma is the thing we're talking today. When the jaw is in a bad position, the bruxisms is creating a trauma also over the teeth. And imagine if this patient have trauma for the bruxisms, bad hygienic, not good alimentation, not good healthy life, and then is arriving the menopause. The menopause is the last drop, no? Because the water is full, and then the last drop was the menopause. But we have to prevent the losing of the teeth in early age, and we have to take a good care in the oral health, cleaning, chewing. Cleaning, when we eat, we have to clean. It's very important. And we have to eat and clean. And that is a thing that the people don't understand sometimes. We have to chewing a lot, because chewing, we clean the teeth also when we chewing, and we clean the teeth, and we do a massage in the gums also. If we do not have trauma with bruxisms, if we grow very well and we clean the teeth and we eat healthy and we train, we will have a good health. That is the receipt to do these things. The menopause, obviously, when the women arrive in the menopause, is arriving, but with a lot of problem before. And menopause was the last. It's not we lose the teeth by the menopause. That is wrong.
Right. One other thing which we have seen a lot is that when people are very anxious or very stressed out, during that time they are grinding their teeth, and also many times what happens is that people tend to have some of these, like especially in India, people chew tobacco. So how damaging, and after how many years of chewing tobacco can the teeth be permanently damaged, or what are the problems which can happen?
Oh, this is very dangerous for the teeth, no? And the stress, the people who have stress, I was talking in the bruxismens, the bruxism is not caused by the stress. The dysfunction causes bruxismens and then causes stress. And that's why we protect the teeth. But if you change tobacco on different things, that is creating a lot of problems in the enamel and in the gums. And chronically, is creating the destruction of the teeth. The most dangerous thing who is destroying the bone, because we lose the teeth also because we lose bone. And the bone is losing because we have trauma, we have not hygienic, and we have grinding the teeth, who moving the teeth, and we are slowly, we are losing the bone. We call that periodontal disease, no? We losing the teeth at the end, no? That's why it's very important. This concept, I hope the audience follow us. They understood the prevention. And I hope the whole profession is follow the prevention, because sometimes we treat the symptoms and we don't know the prevention. No, in normal medicine is symptomatic medicine, but we have to prevent. At the prevention in early age, this is the goal. Believe me.
Yes. So since we are running out of time, one final question I'd like to ask you. That you're very passionate about the teaching which you are doing, and then there are a number of courses you are running. So could you share with our audience a little bit about your work and your university, so that people know and that
Yes.
the biggest interests which you have in your profession?
Yes, I will share. Let me open the web page, and then you can see the thing we teaching. Let me 1 second. I want to the Google Chrome, and in Google Chrome I show you how this is our school. In our school we teach for different professionals. We teach in India also, no? We teach in India. We have a teaching in India. We teach in 3 languages, no? Let me 1 second. I will share the screen again, and I will show you where is our web page where the company who is dealing with us. Let me 1 second, where we are here. Let me share this SCADA Chrome. Okay, look at this is. I think you are looking. You are seeing the sharing. Yes, it's seeing there. Yes, you see that?
Yes.
Okay, this is you see in 3 languages. This is our page. This is the company we deal with our courses. And for example, if you go in English, this is the courses normally. No, this is the courses, and this is the basic course here. We have the how to learn NPR, who is the NPR protocol, no, and then the different courses we normally are doing. Our courses are for all medical science. This is the NPR fundamentals. That is to understand the concept of our protocol. For example, the TMJs and posture, posturometry. We have masters of integrative medicine, in acupuncture, rehabilitation medicine. We have the manual therapy courses. We have the orthopedics, craniofacial orthopedics, the thing we're talking today, traditional medicine, sport medicine, the bed, to how to use the device I told you, different courses. This is in our school, and if the people click here, and they can have all all our formation and the duration of the courses. No, this is a formation we teach in America, in Europe, and now we start teaching in India. We're giving the third course in India, and we're teaching in all Middle East, no, in the MENA region. And our school is an international school, no? It's an international school who is dealing, and we teach for all medical sciences just to work together. We teach nutrition. We teach. I hope in the future I can introduce your nutrition courses in our school, because we believe in nutrition. We believe that nutrition is the most important thing for the health of the body. This is our school. Our school is dealing with all medical sciences and also in all around the world, because we teach in America from north to south, in East Europe, West Europe, India, and Middle East. We cover all the world teaching.
Yes, yes. And I have come to know that you're very, very passionate both about teaching and about the clinicals. So it's really wonderful, because because I think Hippocrates said that a doctor of the future will also be a teacher who
Yes,
will
it
teach
is.
prevention
It is.
and medical
Yes,
sciences.
it is. Well, I love teaching because I have 47 years working. It's not, I have 71 years old, no, but 47 years working in medical science. I have a lot of experience, and we need to teach the young generation to create the new generation of teachers, because I said to my students that they have to transmit also for the new generation, because this is how the world is changing. If you, and in medical science, you have to teach. We have to transmit our knowledge. Why? Because I said that to my students that the truth of today was the lie of the past, but will be the lie of the future, because the truth is changing. And if you don't teach and you don't investigate and you don't share, the philosophies, they meet together, no, to discuss founding the truth. I believe that the medical sciences have to work together. Nobody is the owner of the truth, but if you share the concepts, we will have the truth from today and from the future. That is my meaning, the meaning in our school.
Yes, very beautiful. The truth of today was the lie of yesterday, and
Yes,
the truth would be a very different truth. Very true. And that just shows that how fast the medical sciences are evolving, and the contribution of clinicians like you into advancement of sciences is so, so critical.
yes.
Thank you so
Yes.
much, Doctor. It's been such a wonderful session today. And actually, I learned a lot. I learned a lot myself, because I think the teeth is one of the most important parts of our health and our facial features, everything. I mean, aesthetic as well as health is all connected to the teeth and to the entire structure. So thank you so very much today.
Thank you so much for your invitation. I hope the audience was happy with the topic. And if you want to do something in the future, just tell me, and we can prepare something for you to share with the people, with the normal people, our knowledge also. Because if we do education for the patient, they will change the doctors. That is the goal.
Yes, absolutely. So
Okay.
thank you so much, and you have a wonderful day ahead in Italy, and hope to see you soon on another program. And it was a really wonderful program. Thank you so much.
Thank you so much, and bye-bye. See you next time. Bye-bye. Bye-bye. Bye-bye.